inviting me to be here today. And I had every intention of being there in person with you guys today. I was really excited about making the trip down. And then we had a little issue here at the clinic. So I've got to be in our clinic today as soon as I get done here. And so I apologize. I had hoped to join you guys in person. Maybe, hopefully I'll get invited back and then make it in person that time. So I do, like Allie said, work in our veterinary clinic that's up here at OSU. We see a tremendous amount of lameness. In fact, every single appointment that I saw yesterday was a lame animal, lame beef, either bull or cow. What I really wanted to do today is kind of go over the most common things that we see, how to recognize them, and probably, spend some time on or focus on what I see are a lot of misconceptions about lame cattle and kind of mistakes that sometimes get made. And so hopefully we can help out a little bit with that. Hang on just a second. I'm going to have to, it's wanting me to agree to be recorded. I don't know if I can do that while I'm sharing. Okay, got it. Here we go. Okay. All right. So the first thing I wanted to start out with is defining what foot rot is, and maybe even more importantly, what foot rot isn't. So almost every animal that comes to us that's been lame for sometimes anywhere from several days up to several weeks sometimes, somewhere in their story of that lameness episode, they tell us, oh, we treated him for foot rot. And so foot rot is very common. There's a reason we talk about it a lot, and that's because it is very common. However, we see a lot of things that aren't foot rot being treated as foot rot. And unfortunately, cattle, if they don't respond to that, continue to sort of be treated for foot rot. And we don't ever get really a good diagnosis of what's going on. And oftentimes it's, if they don't respond to a single treatment of foot rot, it probably isn't foot rot. So we have a number of antibiotics that are labeled for foot rot, and they do a very good job. And so if you have a lame animal and you see swelling in the foot, it is absolutely appropriate to go ahead and treat that animal with a presumptive diagnosis of foot rot. The key is that a case of foot rot about 2 to 3 days after appropriate treatment with an appropriate labeled antibiotic should be getting a whole lot better. And if they're not, it is probably not foot rot. Now, there is this thing out there called super foot rot. And in 20 years as a cattle veterinarian, I have never seen super foot rot. So I don't think it happens very often. And I certainly don't think it happens in Oklahoma very much, because I'm pretty sure in 20 years I've seen it. And so for most standard issue cases of foot rot, single dose of something like LA200, Nuflor, Draxxin, those drugs that are labeled, should have those animals well on the road to recovery, and their lameness should be looking a lot better in 2 to 3 days. If it is not, it is not foot rot. So this is what foot rot is, these two images here. So this one here on the left, you'll notice that those toes are separated some, that kind of interdigital space, the space between the toes is spread. And you can tell at the coronary band where the hoof meets the skin, it's swollen kind of in a ring around there. The key here is when you are sighting that foot from the front, like we are here, that swelling is pretty symmetrical all the way around. And that's really the key for what you're going to see, is you're looking for symmetrical swelling down close to the hoof, just above the hoof. Now, on our hydraulic chute where we can flip these things over and look at the feet, or if you were to put a rope around that foot and pick it up in the chute, this is what you're going to see between the toes on the right-hand side. And that is, so you can see on the skin that's between the toes, there's kind of that gray glistening area. That's what that whole area between the toes should look like. That kind of white, gray, glistening. Black cattle, it'll maybe be a little darker gray, but should be nice and smooth, a little bit wrinkly. But you'll notice there's this red, pink, irritated area that's got these ridges in it. And that is dead tissue that is infected with the foot rot organism. And so foot rot, the actual lesion itself, is this lesion between the toes. this is what you're looking for. And if this foot is well restrained, I wouldn't do this otherwise. I always stick my nose in there when they're restrained on our hydraulic chute and smell it, because that's the real diagnostic test. The bacteria that causes foot rot stinks like rotten flesh. And it's a totally different smell than just a manure covered foot. And so when you see that kind of ridging in there, ulceration in there, and that skin looks like it's dying off, that is going to be foot rot every day of the week. But again, the key is this kind of symmetrical swelling. And so, of course, we know foot rot can occur when they're standing in water more. I've probably seen more cases of foot rot in the clinic this summer than I have in a long time. Because we've had these intermittent rains, and when they've happened, it's been in large amounts and cattle were standing in water for a period of time, depending on what the lay of their land was. And so, like I said, these should respond nicely. 2 to 3 days, these cattle ought to be feeling a lot better. Of course, we know because it is a bacteria that's out in the environment, you can have multiple animals with it. You can have one animal with multiple feet. You can have one animal with 1 foot. I mean, it can be any combination of feet and number of animals. So based on what I just told you and showed you with that kind of classic foot rot case, let's look at these feet, because these are actually what usually show up in our clinic up here, because you guys sort of treat them for foot rot. Maybe they don't get better. You take them into your veterinarian. And then we're sort of, I obviously oftentimes get kind of the more complicated cases up here. And so these are the ones that we see that, were treated for foot rot that end up not being foot rot. And so what I want you to notice is I made such a big deal of looking at that foot straight on. And I made a point about this symmetrical swelling, that the whole foot is swollen. And if you look at these 2 feet on the left, the foot is, we'd all agree the foot's swollen, but it is not symmetrical. If you draw a line down the middle of that foot between those 2 toes, one side is clearly swollen, the other one is not swollen. This is not a super common problem, but we see it a lot up here. These cases will not respond to foot rot. These are to foot rot treatment. These are infected joints. So down inside the hoof, there is a little triangular bone, and then there's a joint, and then there's the next bone up. So there are actually 3 bones lined up in each of those toes. And the joint between the bottom 2 can get infected for a billion reasons. Can be foot rot that goes really, really bad, that doesn't get treated and goes into the deep tissues. They take a stick or a thorn in between the toes. They take a stick or a thorn outside. They get an injury to the bottom of the foot, something like that. And that bacteria goes and sets up shop in that joint down in that hoof capsule. Because that hoof cannot expand at all because it's a hard hoof, that pressure can only go up. And so that's why you see that swelling there at the skin just above the hoof, as it's kind of coming out of there. It doesn't have any place to go. You can also imagine that in that hard case of the hoof, that having infection and inflammation in there, because that hoof can't expand, would be incredibly painful. If you have a place on your arm that's swollen, it's going to swell, and yeah, it's painful, but because your skin can stretch, it's not crippling to you. This is crippling. These animals are super lame. They will maybe only touch the toe down, or if they will put the foot on the ground, they break over, and it is a tremendous lameness. Some of these animals won't even want to put the foot on the ground at all. So these are typically more painful than foot rot. And because the infection is in the joint, it's very hard to get antibiotics into the joint. These cattle will not respond to foot rot treatment. Now, these 2 images on the right-hand side are probably more common things that we see that get sort of misdiagnosed as foot rot initially. And both of these are sole ulcers. So these are where an animal gets a bruise on their sole. it gets eroded and it gets infected. And you can see where we've had to take that infected sole off of the bottom of the foot. These don't have any swelling associated with them. These animals are painful and they don't respond to foot rot treatment, and so they remain lame. And so I wanted to just show you these are probably the two most common things that we see in cattle that don't respond to foot rot treatment as being what is actually going on with them. And neither of these, unfortunately, will respond to a simple injection of antibiotics or even multiple injections of systemic antibiotics. And so this is back to those kind of infected joints I showed you on the left. This is an X-ray of a foot that has an infected joint in it. And so, cattle are great because they got two toes, super handy. So that toe that you're looking at there on the left is the normal one. You can see how clean those bones look. If you look at the spaces between the bones, nice and clean. And you look at the toe over on the right-hand side, and it looks like a bomb went off in it. And so you can imagine how painful that is for these animals. And so these animals will lose a tremendous amount of weight. Unfortunately, by the time a lot of them get to me, they've lost a couple 100 pounds because we haven't gotten them properly identified as being something more severe than just kind of a standard sprain or foot rot or something like that. And so I really want to focus today on you guys being able to kind of recognize the difference there so we can identify these early on, because there are things we can do for these cattle. This is a split section of that toe with that little triangular bone down there kind of off to the lower, pointing off to the lower right-hand side. So we've split the hoof top to bottom. And then you can see all that pus in there between those bones. Those bones look brown like that because I sent them through the bandsaw, so they got saw blade burn. But you can see just that nasty infection in there. And because it's down in that hoof, these cattle are just crippled. They don't get up to go eat. They don't get up to go drink. And they really wither away very, very quickly, or can. So what options do we have for those sole ulcers that the pictures I had for you on the right-hand side there? We can just open up the bottom of that hoof, get that all opened up. We put a shoe on them on the other toe, and those cattle go on and heal up and do fine. That's a cheap fix, but you just got to get it identified, because you do have to pick up that foot and get that infection all opened up on the bottom. On these infected joints, or these more severe whatevers that happen to the feet, we can take the toe off. This is what I say is one of the 867 reasons that cows are better than horses. And that is that they have two toes, which means I can cut one of them off and they can keep going. A horse gets an infection down in his foot, he's done. And so we have the ability to take that infected toe off. You looked at that X-ray and that one, we can cut that toe off. And this animal will walk out of the chute nearly sound. It's amazing to me, because I think that infection is so painful that even the pain of the surgery to take this off is nothing compared to that. Of course, we give them pain medication for the surgery, but it's almost mind-blowing. I did a claw amputation last week, and we watched that animal walk onto the chute and just crippled and kind of bounced in the chute because they couldn't even hardly put the toe on the ground. And then I videoed that heifer walking out of the chute, and she just trots out of the chute. And I mean, we're talking, she was in the chute an hour, and just instantly she feels so much better. And she's going to go out and she's going to eat, she's going to gain weight. She's going to do great. The real advantage of this is they come back fast. And so this is great for feedlot animals. This is great for a cow that's maybe in mid to late gestation, and we need to get her to have that calf and raise it. Maybe she's got a calf on her, and we want her to finish raising it. We can cut that toe off, and she's going to feel better instantly. She's going to go back to eating. She's going to make milk. She's going to raise that calf. Now, these cows are going to have an endpoint. None of us can walk around with half our foot gone, and the other part of our leg is going to kind of give out eventually. And so this is all, claw amputation is considered a salvage procedure to meet a production goal. So we have a feedlot steer that gets an infected joint. We're going to cut his toe off. He's going to finish the feeding period well, and he's going to go to slaughter with his peers. That's the production goal for him. That brood cow, we want her to have her calf, and we want her to raise the calf. And so claw amputation will allow for that to happen. And so if we can get these cases identified and get these toes cut off, if it's appropriate, we can keep them from losing weight. We can get them to put weight back on if they already have, and we can get them to do their job. Now, some studies have looked at how long these cattle last, and it depends on which toe you cut off and which leg. So on the front legs, the inside toe is the primary weight-bearing claw, and we know the front end of an animal weighs more. So if you cut off an inside toe on the front end, those animals are going to have a little shorter lifespan. If you on the back end of the animal, it's the outside toe. That's the primary weight-bearing claw. So if you cut off the back outside toe, those animals have a little shorter lifespan. We don't ever like to cut off an outside toe on the back end of a bull, which probably makes sense to you. If he's got to mount cows and put his entire weight on his back end, we don't want him teetering on that inside toe that isn't designed to bear very much weight. But sometimes we can get them to finish out a season. If he does this in the middle of the season, somebody doesn't have enough bulls, we can get a toe cut off, and if he's a collectible bull, we can get him collected. If we need to finish him breeding out a few more cows, we can get that done as well. So those are listed, the longevities are listed on here. Bulls, you can get about 2 years out of them. Dairy cows get a little over a year, and that's just because dairy animals are usually standing on concrete, and that's much harder on them. We really never encourage anybody to get out past their production goals. So like, for example, I would never tell anybody to keep a bull around for 2 seasons that was missing a toe. It's too risky. If I had a bull that was missing a toe, I wouldn't hang on to him for next season and run the risk of him breaking down in the, early in the breeding season and then not getting his breeding finished. So what I tell people is, we're going to cut this toe off with a defined idea in mind. We need him to breed this set of heifers. We need this cow to wean this calf. We need this cow to have this calf and wean it. And then, that cow raises that calf and she gets sold when the calves go. Don't keep those around for next season. Inevitably, that results in some guy coming back to me 2 years later and telling me that I was wrong and he had a bull that lasted 3 years. Well, that's great. I mean, I love to be wrong in that way. I'm perfectly happy to be wrong like that. But it's a gamble. That guy was gambling to keep him around because that bull is at a higher risk of breaking down than any other bull that he owns. And so that's wonderful when they buck the system, but that's a risky move. So what about, is there a way for us to keep that toe? So let's say that it is a really nice bull that we want to keep around, and that, getting rid of him at the end of the season is not an acceptable answer. Or maybe it's an embryo donor cow that we want to keep her around. We do have what we call claw sparing procedures, where we can go in there, drill a hole through that hoof wall and actually sort of scoop all that infection out. It's a bit of a production. It's a little bit redneck. We do use a 5/8 inch drill bit, and we drill right through those toes. We can anatomically, we know where that joint is, and we drill through that completely through and through that hoof of the single toe of the one side. And then we go in there with tools and we scoop all that infected bone out of there and flush. And again, this is because if I just give her an injection in the neck of an antibiotic, it is not going to get in there to where that infection is. It just doesn't travel to joints well. And so this is a way for us to get in there, get that infection out. The difference here is claw amputation. I'm going to cut her toe off. I'm going to send her home with you today. We're going to change her bandage in about a week, and then she's going to be good to go. Pretty inexpensive, not a big deal. Cow is sound instantly. This deal is a bit of a production. I'm going to drill this toe out. We're going to have to keep it under bandages. We're going to change the bandage every day. She's going to stay in the hospital with us. for about a week, and you're looking at a lot of cost here, and they don't become sound right away. Because of all of this, they still stay painful for a little while, even though we give them pain medications for it. And so you have to be in it for the long haul on this animal to do one of these claw sparing procedures. But there are some cattle for whom that is appropriate. In most situations, a claw amputation is the more appropriate answer to an infected joint. Here's just another, here's us kind of drilling in from another angle. And you can see what we've got to do there. And then we go in there and scoop all that infection out. It's kind of cool to do. I would say we only, even at OSU, where we do lameness all the time and we see really valuable cattle a lot, we probably only do this procedure 3 or 4 times a year. There's just not a lot of cattle in the world that this procedure is indicated for. We do a lot more claw amputations. So here is, we talked about the sole ulcers. You saw the previous pictures with the holes in them. You can see on this toe, the down toe is covered up with an exam glove. But that top toe, you can see there's a hole in the bottom of the sole, and the white that you see in the center of that is the bone itself. And so these are, when we have these sole ulcers that progress, we can get into the bone. When it gets into the bone, it's a much more severe deal. So we've got to get these identified very early on when it's still relatively inexpensive to get them fixed, because you're not going to pay me, your veterinarian, very much to pare out a sole ulcer. Those are cheap to do. And I'm going to have them on the chute for about 30 minutes, and I'm going to send them home with you, and they're going to be good to go. Now, how do we get these procedures done? We actually numb just the foot. If you've had a C-section done on an animal, you've had other procedures done that required numbing of a certain area of the body, you know that food animal veterinarians, we like to keep cattle on their feet, not asleep, and we like to block whatever part of the body is that we're working on. It keeps us from having to anesthetize them. And so that saves a lot of cost, and it's a safety factor for the animals. And so we do have a way that we can numb the foot to do this. And we take a rubber inner tube and we wrap it around the leg, kind of mid-cannon bone, just below the knee or just below the hock, just above the fetlock. And we will inject anesthesia into that foot. And so this is a student performing this procedure. Of course, the animal always throws a fit. You can see we've been digging around on this foot quite a bit already, and then determined that it was going to be pretty painful. So now we're going to numb this foot up. There's a vein that runs right down the front of that foot. And you can't see the tourniquet. It's up just above where you can see on the leg. And we're going to hit this vein here, and then we're going to inject lidocaine into that. And what that does, you can see she hits it there. We know we're in the vein, and then we're going to inject that lidocaine. What that does is that completely numbs everything from the tourniquet down. So the tourniquet keeps it from going into the rest of the blood supply. And so this entire foot, from the tourniquet down to the hoof, will be dead numb, and it will let me cut her toe off, and she will have absolutely no idea that we did it. So that's how we dig out these deep lesions and things, is that we're able to numb the foot in that way. Very useful procedure, very helpful in getting these things done. Now, there's another way that we can use that tourniquet procedure, and that is to give antibiotics into that vein. So I told you, if I give this cow a shot of Draxxin in the neck, it's not going to get into the infected joint. It just doesn't distribute well there. I can't get it into where it needs to go. And so that's why we have to do a surgery or whatever, dig a hole, so we can get in there and clean that infection out. We can do that procedure you just saw with lidocaine and put antibiotic in there and get more of the antibiotic into that foot than we would if we gave it in the neck, because we're concentrating it in the foot. High amount in that foot. Now, the problem is that no drugs that we have are labeled for doing that, for being given as this regional antibiotic treatment into the foot. We do have some data about certain drugs, 1, 2, 3, 4, 5, 6 drugs there. So 6 antibiotics, somebody has looked at how they would work in the foot if we gave them that way. And we determined that it doesn't cause damage in the foot. But you see 4 big red X's right there next to those. And that is because all of those 4 are either no longer on the market, or it would be illegal to use them in this way, injected into the foot. So we know about 6, only 2 can we even use in this way. Now, those are ampicillin sulbactam at the top of the list, and then fluorophenocal, which you know is Nuclor. Now, I don't know if you could appreciate on this video how small that needle is. That's a 19 gauge needle. You guys are used to using 18s and 16s probably, primarily. So it's smaller than that. And how do you think it is to get Nuclor through a needle that's even smaller than an 18 gauge needle? Very, very difficult. How many of you have tried to use Nuclor on a cold day? I mean, it's like maple syrup. And so it was actually one of our clinicians here at OSU who did that Nuclor study about 15, 20 years ago now. But it's extremely difficult to give Nuclor in that way. And so we almost always use this ampicillin drug at the top. But as you might imagine, we're not very happy with really only having one drug that we can use, because what if the bacteria that animal is affected by, what if that one antibiotic doesn't work against that one? And so we feel like our hands are tied in a lot of ways to be able to treat these deeply infected feet like this. And so we had a generous donor provide us with some funding. And so we are expanding the list. We've taken this list of what we know about, and we're looking at some other drugs. And so we are currently here at OSU, we have a teaching herd of beef cows that we use to teach our students palpation and handling and all their skills that they need to know to be veterinarians. And we are using those cows also to test more antibiotics and see what other options do we have to provide you guys with better alternatives for how we can treat these feet. And so we're really excited about this. We feel like we're getting some good information, and that we're going to soon be able to offer some better alternatives than what we currently have. So kind of neat stuff there for us. We really like feet a lot. And we also mostly like cattle not being in pain. So are there any questions about any of that before I go forward with the kind of the rest of these?
No, I think they're good, Dr. Jones.
Okay, good. Thank you. All right. So the next thing I wanted to address was corns. There are a lot of misconceptions about corns in the world. And so I wanted to talk a little bit about them. I had a bull with a corn in the chute yesterday that we had to kind of make a decision about whether or not it needed to be removed. So I think the most important thing for you to take home about corns is that a lot of cattle have them, and a very small percentage of those corns will ever cause a problem and will ever need to be surgically removed. That's the good news. 99% of them will never cause a problem and don't need to have anything done with them. We think that corns form, so if these are kind of the 2 toes, we think that they form when feet are having to shift around a lot. So you have very uneven, rocky soil where the toes are moving. It kind of have to move independently a lot, puts a lot of pressure on that skin between the toes. And we think that that might be a contributor. I also see them a lot just in very, very heavy bulls. And I think, again, it's just stress that's being put on those toes by their weight. So you've seen corns, you maybe have cattle that have corns, these kind of wart-like looking things that grow between the toes. So what I encounter a lot is people will bring me an animal that is lame, let's say on the left front foot. And that animal happens to have a corn on the left front foot. And so they will bring that animal in and say, I want that corn removed because he's lame. He's got a corn there. It's got to be that corn. Well, it might be the corn. It also might not be the corn. He might have a hole in the bottom of his foot. He might have a nail in his foot. He might have an infected joint. And it happens to be a foot that has a corn on it as well. So when I evaluate a corn, I pinch around on it and I push on it and I squeeze the animal's toes together. If that animal is not painful, does not jerk their foot back when I push on a corn, that corn is not the cause of them being lame, and I need to go looking for the real reason. So unless that corn is painful to the touch when you touch it, that corn is not the issue and therefore does not need to be removed. I have a client up here that I like him a lot. He's a good guy. He's got Herefords, but he wants all the corns cut off of all his cattle. As soon as he sees a corn, he wants me to cut him off, or one of my partners to cut him off. And nothing I can do can convince him that this does not need to be done. And we need to remember that this is surgery. Like, we're going to make a hole in this animal's foot. These animals walk around in their own manure. There is a risk of infection and a risk of that going badly. Now, most corn removals, we never see a problem with them. It's a very straightforward procedure to get these removed, and these animals typically do great. But doing unnecessary surgery is not something that any of us can condone. But he is just decided that his cattle cannot have corns on their feet. And so we battle this all the time. If that corn is not painful, there is another reason that that animal is lame, and we need to get that found out, and the corn does not need to come off. And so that middle picture is just us showing the surgery. We put exam gloves over the toes because they're always covered in manure and nasty, and we can never get them fully clean. And then we just make incisions down each side of that corn, and we just cut it out like a wedge. And then that right hand picture there is about a week down the road, how they look. Like I said, they do typically heal up very quickly. But again, it's not a zero risk procedure. And we do this procedure under that regional infusion of the lidocaine as well with the tourniquet. So they just lay there on the chute and don't feel it at all. Now, this is a pretty controversial foot condition of cattle. If any of you guys have Black Angus, you may have encountered this. Maybe more importantly, if you have Black Angus, when you're going to buy animals, you need to be looking at feet. No matter what color or breed you're buying. But Black Angus seem to have the biggest feet issues. And so this condition is what's called corkscrew claw. We will typically see this corkscrew shape form on the outside toes of the back legs. And it often will happen on both toes at the same time. Sometimes one side will be worse than the other, but nonetheless, they're sort of both involved to some degree. Some of them will be a little bit like this one on the left, and some of them really get out of hand, like this one on the right. Now, the reason that this condition is controversial is that there are some people out there who don't believe that it is heritable or genetic. And I'm going to tell you right now that unanimously up here at OSU, we all agree that it is heritable, and that animals who have this condition should not be used in a breeding program. If a bull has this condition and he is retained for breeding, it should only be for as a terminal sire. So his calves should all go to slaughter. So what happens to these animals is that outside wall grows actually up underneath the foot, and it puts pressure up on the bottom, and they actually end up with these lesions. They can end up with these lesions like you see here on the right-hand side, because they bear weight abnormally on the bottom of the foot as that toe kind of curves around. And so these animals will become very lame periodically throughout their entire lives if they're maintained in the herd, which again, we do not recommend. They can be kept trimmed up and be kept pretty comfortable, but again, to what end? Because they should not be kept in the breeding program. Now, the real problem with corkscrew claw is that a lot of animals don't show you don't start to see the corkscrewing until they're about 2 or 3 years old. Well, that's a problem in the bulls, right? Because by the time they're 2 or 3 years old, there's a lot of babies on the ground, and there's been a lot of heifers retained potentially, or if they've been used for AI, there's just this exponential number. And so corkscrew claw is something that we're probably going to battle for many, many years to come. But these animals need to be identified, diagnosed, and they need to be removed from the breeding program. Because not only are they themselves going to have lameness issues and be uncomfortable and all that goes along with, and suffer all along that goes with that, but they are continuing to produce offspring that are going to have the same issue and continue to pass it along. So this is a really significant, we see this a ton up here at OSU, a lot. Way too much. Okay, one of the last things I wanted to talk about is cranial cruciate ligament rupture. So you will read, and people will say that 90% of cattle lameness is in the foot. And given that I've spent 90% of this talk talking about feet, yeah, that's true. I would submit to you that that statistic is probably a dairy cattle statistic. You can imagine dairy cows, because of the way they're fed and the way they're housed, oftentimes on concrete, they really do have a ton of foot problems. Definitely more so than beef cattle. I would say in beef cattle, it's probably more like 75 to 80% of it is in the foot. So it's still a lot. We still see a ton of foot stuff. It's still, keeps me busy all day in the clinic. But there are things in beef cattle that happen higher up on the leg. And so sometimes I will lay a lame animal over and we'll look their feet all over and we can't find anything wrong with them. And if that's the case, there may be something going on higher up. And so this is one of the most common things that we see that is not a foot lameness. So you guys know about running backs and anterior cruciate ligaments. When they say a running back tore his ACL, this is the same thing. In cattle, in things that walk on two feet, it's called an anterior cruciate ligament. If you walk on 4 legs, it's called a cranial cruciate ligament, just a difference in veterinary and human terminology there. But this is the ACL of this bull. And they can tear this just like the running backs do. The way the running backs do it is they're on a run and they plant one foot and they turn to avoid a defender. And when they plant that foot, that ligament, so you've got your thigh bone and your shin bone that meet here at your knee. And if you plant your foot hard and you your body keeps running forward, your thigh bone slides forward and you can tear that cruciate ligament. And so that's how they do them, is that kind of cornering action. Dogs do it chasing squirrels. The squirrel corners, the dog corners, and his knee goes the wrong way and he tears his cruciate ligament. In bulls, they're not chasing squirrels, but they do step in holes. They mount a cow and come down wrong, all kinds of things. And we do see this in cows as well. You'd probably be surprised at how many cows and bulls tear the ligaments in their knee. And so this image on the right is an X-ray. And what I hope you can appreciate there, so the bone on the top is your thigh bone, your femur. And the lower bone that's the top of your shin bone. And I hope you can see in that they're not lined up. That shin bone is shot way forward. The purpose of the cruciate ligament is to keep your shin bone back in line with your thigh bone. And when it tears, that moves forward and it hurts. I mean, it hurts to not have your joint lined up. Ask a running back. Or this bull. So this bull at Red Angus, really nice Red Angus bull, came into me a few weeks ago. Nothing wrong with his feet, but you can see his lameness. It's a moderate lameness, not super duper severe, but that bull's painful. And in fact, when I get in the chute with him and feel of his knee, that his knee is full of fluid. And so this is something that you need to be aware of. because this is actually relatively common in beef animals. And we need to get it. And like I said, we see it in more bulls than we see in cows, but it happens in cows. In my experience, it happens more in overconditioned animals. Now, you can appreciate by looking at this guy, he's lost a lot of weight. And I happen to know the owner of this bull well, followed up with him. This bull has continued to lose weight. They are keeping him around for their own reasons. But you know, this is significantly painful. They're not going to get up and graze like they should. They're not going to get up and come to feed like they should, those kinds of things. Now, what we can do and what we're doing for this bull this guy's keeping around is we can put them on anti-inflammatories, put them in a small area, and they can potentially heal that up. They will never become fully sound, but they would be collectible, you know, if it was an animal that was valuable enough to collect, those kinds of things. So know that not everything is in the foot, and that blowing out your knee actually happens in bulls from time to time. Hairy heel wart, actually had one of these on the shoot yesterday also. This is a condition I'm hearing more about on the beef side. This has been historically a dairy disease. This is caused by a bacteria, it's contagious, and it can spread through a dairy like fire, because once it gets in the environment, all the cows walk through it and everybody gets it. And you can see what the typical thing looks like. That middle picture, I think, is probably one of the best ones. There's a reason we call it hairy heel wart, and that's because it looks like a wart and it's hairy. It's got these kind of hairs on it. The one on the left is sort of less hairy. It's kind of flatter and doesn't look quite like a wart. And then the one on the right is actually not on the heel. It's on the front of the foot. So it can happen anywhere. It just mostly happens on the backside, back there at the heel. Again, it's a contagious bacteria that causes it. These animals are incredibly painful, very painful. When I have an animal on the chute that it looks like a hairy heel wart, I told you for foot rot, my diagnostic test is that I stick my nose in it and smell it. Hairy heel wart, I either touch it lightly with my finger or I blow air on it. Either one of those things, the animal will almost jump out of the chute. Even just air blowing on a hairy heel wart will make it painful. It's just amazing how uncomfortable these animals are. The treatment for this is actually not an injection of an antibiotic, even though it is a bacteria, but actually topically, we put the antibiotic on the lesion. That is the most effective way to do this. And so we will bandage them with a tetracycline powder, and that will heal these up. But we need to get them recognized, because this is obviously not foot rot. It's not going to respond like foot rot. In the dairy scenario, they actually will walk down the stalls behind these cows when they're all lined up in their headlocks, and they will wash their feet with a hose, and then they will actually make a tetracycline solution and put it in a lawn sprayer, and they will walk behind the cows with the lawn sprayer and spray the heels of all those cows when they're in an outbreak. Fortunately, that doesn't really happen in beef animals. We don't typically have big outbreaks of it. But the key here is that this is another situation where an injection of an antibiotic isn't really gonna do us a lot of good. And this hairy heel wart that I saw yesterday was a beef animal. And one of the extension agents who was attending the session that Allie was talking about, where she had heard me speak before, came on at the end and said that, and I don't remember who it was or what county he is in now, but I remember him coming on at the end of that talk and saying that he was seeing a lot more hairy heel wart in their area as well. So you might encounter this. Okay, the last thing I was going to talk about was fractures. I'm not going to spend much time on this. There's going to be kind of two main things I'm going to tell you about fractures. And that is that it's important where they are. And I'm going to talk to you just real quickly about kind of how to splint them. So this is mostly about baby calves, because that's typically where we see broken legs, what we call mama trauma, moms stepping on their calves and breaking their legs. So I get a lot of phone calls and they say, I have a baby calf with a broken leg. What are his chances? Or what are my options for fixing him? And there's some things I need to know before I'm happy to answer that question, but I need to know some things about that. One is it a front or a back leg? Will he walk on it at all or not? How painful is he? Is the break above or below the knee? So the carpus, the knobby knee on the front, or above or below the hock in the back. That's critically important to what his chances are. And then I need to know, is there bone sticking out? Is the skin broken, or is there any blood in the area of the break? So let's kind of talk about why I need to know those things. So the front or back leg, how painful they are, and is it above or below the hock or the knee? Anything below the hock or below the knee is typically very fixable with a splint. Pretty inexpensively, we can slap splints on that, and most of those are going to heal, especially in a baby where they heal very quickly. Anything above the knee or above the hock gets a little bit trickier, sometimes quite a bit trickier. So that's why there's a smiley face down below the knee, is for that line below the knee, is we can usually fix those, and it's usually not very expensive. Moving up from there, it becomes trickier to get those to heal. Those are less likely to heal well. If there is blood in the area of the fracture, or you can see a clear break in the skin, or the bone is sticking out, those are almost impossible to get to heal. And it doesn't matter where it is. Bone sticking out, or there's a break in the skin over the fracture, those are not going to heal. And the reason is they get contaminated and they get infected, and infected bone will not heal. And we've already talked about kind of multiple times this morning about how getting antibiotics into bone to kill bacteria is very, very difficult. It doesn't work very well. And so you'd be looking at a tremendous, I tell people, if you bring me a calf and he's got a broken leg and the bone is sticking out, this is really blunt and maybe kind of rude. I don't care how much money you have to spend on him. I probably can't fix him. And so we try to be really honest with you about what their chances are, and it's not good. And so my recommendation is, if you got one with bone sticking out, he probably needs to just be euthanized. But if they've got a fracture below the knee, below the hock, and it's not broken, the skin isn't broken, you got a really good chance of getting those to heal. Those will typically do pretty well with a splint. So just a word about splints. I love PVC pipe split in thirds lengthwise. That gives you about the right curvature to go on the bone. And that's what we use. We just have split pieces of PVC pipe laying around. And we take a grinder and we round them off so the edges are smooth and do all that kind of stuff. But what you want to know is, when you're splinting a leg, you need 2 splints on it. So you want 2 pieces of PVC, and they need to be at 90 degrees to each other. So if you look at this my little artistic drawing up here at the top, that's a cross section through the round bone. I want a piece of PVC on one side of it, and I want another piece of PVC immediately next to it. So we don't put a piece on the front and back. We don't put a piece on the 2 sides. We pick one front or back and one side. The reason that is it's going to stop bending in both directions. So if I just put one splint on my leg, if I've got a break right here, and all I do is place one piece of PVC or a piece of wood right here, my bone can still bend side to side. And if it's wiggling side to side, it's not going to heal. Any kind of motion is going to inhibit healing. If I put one on top, it can't bend in this direction. And if I put one on the side, it can't go in this direction, and I can get those to heal. So if you're going to splint these at home, pad them very well. PVC split in thirds works really well, and make sure that you use 2 pieces and that they're 90 degrees to each other. And and make sure that you put them up really high. It needs to go above the knee and above the hock, depending on if you're working on a front or a back leg. So don't just put a short piece right over the fracture. It needs to be really long. And with that, left a little time at the end here if there are any questions, or if there's something I didn't talk about, or you want to talk about anaplasmosis, whatever. You got me for a little while longer. So any questions you got for me, you might as well ask them. I'm happy to answer.
On that tetracycline powder,
Yes,
cycling powder on the area heel wart,
yes.
my veterinarian won't write a VFD for me for that.
So for the tetracycline powder, okay, so I think we're talking about two different things. So there is chlortetracycline that's going to go in the feed, and that is not going to be helpful for hairy heel wart. Now there is a tetracycline powder that will that I think is a water-based product that we will use as a topical on there. Something to ask about is, would he be more comfortable with you using something like the injectable tetracycline and using that topically instead of the powdered form? Is that the concern? Are you trying to get so there are these small packages of tetracycline powder. Is that the product that you're talking about?
Yeah, the 324 tetracycline powder.
Yeah, okay.
Part of the VFD.
Right. So another option would be to use injectable like LA200 and use that as part of your bandage.
What about the corkscrew? The corkscrews, hoof. Can you non-lame? Can you clean those up pretty good with hoof trims? You get a lot of those in for hoof trims. Can you clean those up pretty good with the hoof trim?
Depends on how far advanced they are. So if you bring me this,
They're not lame.
yeah, I guess what I mean by advanced is like how curvy they are. Cause like this animal on the right-hand side might not be lame, but he's super screwy. So this one on the left where he's not crossed over a lot, I can probably trim him up and make him look pretty good. The purposes of which, of course, are to keep him from walking abnormally. This one on the right, I can make it look a lot better, but it's still gonna have that curvature that it shouldn't have. And honestly, being able to trim these up and look pretty is probably part of the problem, because then people go and sell those animals because they get them all trimmed up and look pretty nice. That's why you got to look at feet really closely. And so, yes, we can shape them up a lot better and get them to bear weight more normally, but they will always have some misshapenness to them. And even more so if they're allowed to get to the point like where this one is on the right.
Is there any way that we could do some genetic testing for that and then mark those cattle because they don't need to be in the gene pool?
Right. So as far as I'm aware, there is not a gene test for corkscrew claw that I'm aware of. And so until there is, you're not really going to be able to test that. You are at the mercy of people being ethical and not remarketing, not getting these animals trimmed up and remarketing them. If there is one piece of advice I can give you when you go buy a bull, it is get him out of shavings. You know, a lot of times these young bulls, they'll put them out there in tall grass for you to look at, or they'll have them in real thick bedded shavings for you to look at. Make them get them out of there and walk them on flat ground for you and really look at those feet. Unfortunately, if you're buying at a yearling sale, it may not really be showing up yet. But even some yearlings, if you look at them and they're starting to get a long toe on them, if you're starting to see even the slightest problem in the foot or in the hock, for that matter, if they got puffy hocks, if you see those kinds of things in a young bull that you're looking at purchasing, go find another one. Because if they're having those kind of problems at a year of age, wait till they're 3 and 4. And if you say, oh, well, his toes are long because they really fed him hard to make him big and fat for the sale, well, that's a problem too, because that means that he's probably had some laminitis. He's maybe foundered a little bit. He's maybe had some rumen acidosis. I mean, I don't want a bull that's been pushed and is super fat either. So the feet can, you know, the eyes are the window to the soul, but the feet, pretty important too, when you're looking at animals to buy. Don't buy them when they're standing in 8 inches of shavings. Get them out, look at their feet.
Thank you. I know that's a major concern for us when we're looking at purchasing young bulls. And I just think that could be a selling point for, say, Angus. We could start genetic testing for that or something and say, hey, this bull is clear, you know, doesn't have those genetic factors or
Right,
whatever.
right. Yeah.
But we're not there yet.
Yeah, stay tuned to that. And I think, you know, I came down hard on Black Angus, obviously, when I sort of introduced this topic. You know, Angus is moving in the right direction. They now have a foot scoring system. You know, they've put these things in place because they realized after a long time that selection only for ribeye area let a lot of other things slip, and feet were probably, you know, one of the biggest things that slipped when we were just selecting for ribeye area. If you single trait select, other stuff's going to go back. And feet did that in Black Angus. And so now they've got a foot scoring system to help you guys evaluate these. If you don't know about that scoring system, I would encourage you to go look at it. It is on the American Angus Association website. Even if you're not into Angus, steal from Angus. You know, the foot scoring system is a really good way for you to look at what a foot is really supposed to look like. And then see what the variations of abnormal and what you should be trying to avoid. So it's a really nice chart. It has little diagrams of feet on it. It's actually pretty handy.
I had a bull that built a crack in the hoof at probably 4 or 5 years old, and got that worked on and healed up, and then it developed again a couple of years later.
Yeah.
Is that something that maybe a hereditary type situation, vitamin, mineral type thing?
Yeah. So that's a great question. I did not talk about, and I'm assuming you're talking about a vertical crack that went up and down in the foot and not a horizontal. Yeah. Okay. So those are much more common. So we see vertical cracks a lot. We typically go in and Dremel those out. Probably what your veterinarian did, went in there and cleaned it all out, widened it up. We'll shorten the toe off to try to help those animals break over a little bit better. So with regards to whether those are genetic or whether those are environmental or trace mineral stuff, to all of that, I would say yes. So to get more specific, is it genetic? Potentially, because it is a hoof horn quality issue. So you can have animals who genetically have bad hoofs, you know, just the quality of their hoof wall is not good. I would say that is probably actually pretty uncommon. Pretty uncommon. More likely, vertical cracks, and you'll sometimes hear these called sand cracks, are the result of dry environmental conditions, abnormal pressure on the toe. So you could imagine if an animal has a long toe, and when they break over and they step over on that toe, that puts pressure up here on the hoof wall and can crack it. So one of the things I do when I'm treating vertical hoof cracks is I cut the toe off as short as I possibly can, so they break over easier and they take that pressure off of that hoof wall. So dry conditions can do it, we think. Also, trace minerals. I'm going to tell you, trace minerals are the single most important thing that you can deal with regards to foot health of anything. We can talk about the need to maintain dry pastures. We can talk about, you know, all this kind of stuff. But if your trace mineral program is high quality, that is the best thing you can do for feet. It's the best thing you can do for a lot of things, but for horn quality, biotin and zinc are probably the two most important nutrients, two of the most important nutrients specifically that we talk about with regards to feet. And so I will tell people, make sure that you've got a high quality trace mineral supplement out there and that the cattle are eating it, because that's another problem, is sometimes they don't eat certain things. Different herds have different tastes, it seems. But I will tell people, if I find cracks, you know, you might want to look and make sure your trace mineral has got biotin in it. And if it doesn't, you might consider, you know, figuring out how to add that in. Or do you have a good quality source of zinc in your trace minerals? And we can spend a whole day talking about the quality of different trace minerals. But one thing that we do know is that some of them have relatively low bioavailability. Bioavailability just means, is it available for the animal to use? Is it in a form the animal can use? So for example, we know that zinc oxide, it's got zinc in it, it's zinc, but it's only about 30% bioavailable. So you feed zinc oxide, if zinc oxide is what's in your trace mineral, only about 30% of what's in there is even available, is really useful to your animal. Versus zinc methionine, that's about 90% bioavailable. Well, guess what the difference is between those two things? Price. So you do get what you pay for when you're looking at trace minerals, and it's worth asking questions about, is, you know, what is the sort, and I'm talking about zinc because we're talking about feet, but this matters for all the trace minerals. What form are they in, and what do we know about how available it is to the animal? That's a little soapbox for me. Sorry, I probably told you a lot more than you wanted to know, but trace mineral, you're right to ask about that. Trace mineral, very important.
Will a good mineral help prevent foot rot?
Yes. Can. Now, I'm not going to tell you you're not going to have a foot rot outbreak in a really wet year, but having a good trace mineral program, iodine is very helpful and can be very helpful in preventing foot rot. Zinc, again, is important. You know, trace minerals play such an important role in just in your immunity in general. And so anything like that is infectious, that is a bacteria that your body would have an opportunity to mount an immune response to, can be helped by trace minerals stimulating that immunity. Absolutely. Copper is important in immunity.
How much of this problem is related to the size of the cattle that we bred out? 1,500 pound cows and over ton bulls.
Yeah. Yeah, a 1,400 pound cow on 1,000 pound cow feet is definitely a problem. And I mentioned that with corns, that I do think that these very heavy animals are predisposed to corns. And absolutely, you know, if the feet didn't keep up, so to speak, that can be a problem. And so, you know, that hoof wall is designed to bear a certain amount of weight. And the sole, that softer sole, is designed to handle a certain amount of weight. And so whether they are very large from being over conditioned or they're very large because of their frame, absolutely, we see problems related to animals being way too heavy and very, very big. And as I think I mentioned, we think that the cruciate tears, those ACL tears are probably related to obesity and just and not necessarily obesity, I guess, but just big, heavy cattle.
If you have a cut that's on the hairline or coronary band there towards the back or the heel where it's not going to stay clean very well, and let's say that got infected, how do you treat something like that?
The trick is to try to keep it covered up in some way. Now, in general, I am fairly, are you all able to hear me okay?
Yes.
Okay,
Yes.
I got a little message that my internet was unstable and I kind of live in the middle of nowhere. So I was just making sure. So I am, in general, I am fairly against putting bandages on feet. And the reason for that is that if that bandage gets wet and it gets manure on it, which it's going to, it's just going to hold that up against the wound. So I would sort of rather the wound be open to the whole wide world and getting air to it rather than having muck and manure stuck to it. In the situation you're describing, it sounds like potentially, depending on the wound, that having a bandage on it would be useful. If that's the case, then you're going to have a place to put that animal. And so getting them in the chute, getting that thing scrubbed up really well, and then getting some kind of covering on it. But then that's, they're going to have to stay in a place where it's going to stay relatively dry. And I tell people, sometimes your cleanest, driest place is way out on a big pasture and not in a stall or not in a small area, because in the small area, you're going to concentrate their manure and urine. That may be wetter and nastier than just turning them out on pasture. And so you just have to decide that, you have to look at what your options are. And, people, I say, keep them up where you can keep an eye on them. But if your cleanest, best place is out on 40 acres, that may be where they need to go to get that healed up. The thing that I kind of, the little asterisk that I would put on a laceration on the back of a foot is there are two really important tendons back there that we see get infected with some regularity. And they almost always get infected from a deep laceration on the backside of the foot. And so that would be one thing where if they have a laceration on their foot and they're not very lame or they're not lame at all, it's probably not gone very deep. If they've got a laceration on the back of their foot and they're pretty darn lame on it, it's probably gotten into something important and needs more work than just to be cleaned up and put a bandage on.
Okay, thank you. I had pretty much the exact scenario you recommended, and we actually we put a diaper and then Gorilla Tape on it.
Yeah.
It had got infection, kind of ulcered and kind of blown out a little bit, even though she'd had a couple rounds, but we got it cleaned up and wrapped, and
Good.
we turned her out because that was the driest, like
Yeah.
you said, exactly same thing. Well, now the Gorilla Tape hasn't come off and I'm gonna have to catch her and
Now
cut
you
it
got to
off.
get her back.
But she's doing quite well, but it kind of brought up the question, like, I don't know whether we should wrap it or not. And
Yeah.
so I just wanted to know kind of the opinion on that and if there was something better to use that I wasn't thinking
No,
about.
actually a diaper and either duct tape or Gorilla Tape are great. I mean, we go through, like, we should just have them bring in a semi-loaded duct tape to our place. With as much footwork as we do, we just encase these feet in duct tape. It is the best waterproofing tape they've ever made. And of course it's dirt cheap. And we make these duct tape boots actually that we kind of create and put on the foot. And Gorilla Tape, we keep Gorilla Tape around because it's really nice too, but as you know, it is like duct tape on steroids. I mean, it is so sticky and it's hard to get off of things. And so if we really need one to be totally bulletproof, we go to Gorilla Tape. If we just need it to be decently waterproofed, we'll seal that foot up with duct tape, of course, outside of a bandage that's on the foot. You never want to put duct tape or Gorilla Tape directly on the leg.
Thank you.
Sure.
You have any questions? All right, Dr. Jones, I think that's all the questions they had.
Awesome. Those were great questions. Thank you all for asking them. It's fun for me to get to hear what you guys are seeing and thinking. So I appreciate that.
Well, thank you for
Thank you.
coming and speaking.
Sure. Happy to do it. You
Appreciate it.
guys
Thank you
have
very
a
much.
good rest of your day and thank you so much for being here. It's good to meet all you. Hopefully next time it'll be in person. Take care.